Good day everyone, my name is Huevos and today I will be talking about the 12 cranial nerves. So without further ado, let's get started. First is we will wash our hands and then introduce ourselves and then confirm the patient's details, explain the procedure, and then gain the client's consent. First, cranial nerve is the olfactory nerve. We will ask the patient if he or she can smell something. For the second cranial nerve, it will be the optic nerve. Here we will check the client's pupils. So first is we can check the size and alignment. And the next is the visual acuity. We can ask the patient if she or he is wearing glasses. And then we can proceed in reading the Snellen's chart. Next is the pupillary reflexes. You can place the hand in the middle and then check for the pupils reflexes in a dimly lit environment by using a pen light. Next is the swim light test, which can reveal a relatively apparent pupillary defect. Next is the accommodation reflex. We can check the constriction and convergence of the pupil. Next is we will assess the color vision, then a visual inattention, and then visual fields wherein we will cover one eye and then check if the patient can see. And then next is perform fundoscopy. Next will be the oculomotor nerve 3, and then the trochlear nerve 4, and then the abducens nerve 6. So in these three nerves, we will raise the index finger and then let the pupil follow it in its direction. And then note any restriction of eye movement. Next is the trigeminal nerve 5. We will instruct the client to close their eyes and then use a cotton to dab it on their ophthalmic branch, maxillary branch, and then in the mandibular branch. We will ask if the client can feel or sense anything. And then next is the pin prick sensation. It is the neural tip, or we will prick them using the same parts. Next is we will also assess the temporalis masseter muscle bulk or wasting. We will touch here and then let the client crunch their jaw and then touch the cheeks to crunch the jaw again. Next is the jaw jerk reflex. We will place a finger here and then tap if the client feels anything. Next is the facial nerve 7. First, we will instruct the client to raise their eyebrows and then close their eyes. Try to open it and then inflate your cheeks and then press your lips and then show your teeth. We can also ask the client for any change in taste, hearing, and then we can also inspect the external auditory meatus. And for the vestibulocochlear nerve 8, we can check the client's hearing. Cover one ear and then stand 15 centimeters away and then stand 60 meters away. And then for rinse test, we will let the client hear the sound of the tuning fork at the back of the ear, left and right. And then next is we will place the tuning fork in the middle if the client can hear or feel anything, which is called the Weber's test. Next will be the turning test. We will instruct the client to close their eyes while marching. If the client stays on their position, it is normal, but if the client turns in any direction, that is a sign that there is a lesion. Next will be the glossopharyngeal and the vagus nerve 9 and 10. We will check the uvulus symmetry and the uvulus movement. We can also instruct the client to cough or swallow. And then we can also check the patient's gag reflex, but it is not required. And for the accessory nerve 11, we can check the trapezius muscle by instructing the client to raise their shoulders and then press it down. And then instruct the client to move their head and then push in the other direction and vice versa. For the hypoglossal nerve 12, we will inspect the tongue at rest and then inspect the tongue when it is protruded. And then lastly, we will test the tongue on their cheeks and also on the other side. So that is it for my 12 cranial nerves. Thank you.